I'm a senior insights manager in the behavioral science and insights unit at the UK Health Security Agency. And I've been at UKHSA since July 2023. So it's almost been 2 years now. And before that, I was working as a senior ethics and technology researcher for Ethicas, which is a research company based in Barcelona, Spain, focusing on ethics and AI in research.
Okay, great. And tell me, when you were about 7 or 8 years old, what was it you really wanted to be when you grew up?
Well, when I was 8 years old, I wanted to be a ballerina. I really loved to dance. But I have to say, I used to say that I wanted to have a job that would allow me to help people. I just didn't know what that would look like. And I've always been interested in how people behave, both individually and in a group. So I guess I've always been a bit of a researcher all along, just I didn't know what a researcher was yet.
Great. Virginia, so can you tell us more about your role specifically and just give us an idea of what you find most enjoyable about it and what you find less enjoyable about it?
Of course. So my role as a senior insight manager is to bring to life the experiences and voices of the public and our stakeholders in compelling ways to inform health protection decision making. And in doing that, we use insight from both social and market research, but also behavioral science and internal and external data and stakeholders' feedback to present our insights. And as part of this role, I manage the People's Pulse panel, which is an online community research panel of around 8,000 members of the public, who we work with on a different range of qualitative and quantitative research and engagement activities. And I think the part that is most enjoyable about my role is that we get to see and show the impact of our work in informing strategic and evidence-based advice that will inform both strategic priorities, but also service improvements and decision-making. While the most difficult part of my role is that we often need to gather information about protective behaviors and perceptions of risk to health very quickly. And this means that we are always looking for innovative ways to do research at pace and cost effectively, which is not always easy to do.
Okay, Virginia, so what is your definition of insight?
So my definition of insight is, insight is the bridge between data and action. It's not only about collecting information or communicating insights, but it's about uncovering the deeper meanings behind what people feel, think, and do, and translating that into something that is useful to inform better decision and drive meaningful change.
So, Virginia, how do you personally use insight in your role?
I personally use insight as a foundation to shape policy, but also inform strategic thinking. And in practice, this means drawing on a mix of quantitative and qualitative data to make sure that our insights are embedded in evidence-based. And I used to build a rounded picture of the issues we're tackling to make sure that are also aligned with the objectives of our organization, whether that's about vaccine uptakes or service access or health inequalities, for example.
Great. So how do you work together with your insight team?
Collaboration is at the heart of what we do in our insight team. And as a senior insight manager, I work closely with priority topic leads to make sure that our insights are strategically focused and embedded in robust behavioral science and social research. And we're constantly sharing learning with each other, but also challenging ourselves and our thinking and supporting each other to make sure that we deliver insightful and impactful data. Our mission is to generate and apply behavioral insights to inform decision-making, and that requires us to be both curious and strategic in what we do. And what this means is that we spend a lot of time navigating complex stakeholders' landscapes and building trusted relationships, but also co-creating research that is delivering evidence-based and stakeholder-informed insights.
Okay, so Virginia, what features of InsightHub do you use most often? And how do they support your objectives?
So the feature of InsightHub that we use most often in our work is for sure SurveyMR. I have to say it's incredibly flexible and supports a wide range of our objectives, from rapid response to incidents and also more in-depth evaluations, for example. And we use it for, to recruit participants for qualitative projects or for quick engagement or feedback exercise, but also for conducting more robust evaluations where we might need to split samples or create a control group or even run repeat surveys over time. And I have to say the biggest strength of InsightHub is the responsiveness of our panel. That means that we can reach a large number of participants very quickly, and that is essential when we have to gather insights at speed, like when an incident happens and we need to respond quickly.
That's great. So could you perhaps share a recent example where InsightHub played a key role in delivering an insight that really made an impact?
An example where InsightHub played a key role in delivering insights that made an impact was recently we tested a set of updated patient leaflets on managing common infections such as respiratory tract or urinary tract infections. And these materials were being revised on both content and design. And our goal was to ensure that they remained accessible, clear, and appropriate for patient use. So what we did was using a combination of question board MR and smartboard MR. And firstly, we shared PDF versions of the materials through question board MR with participants to asking them a few open-ended questions to gather feedback on their overall impressions and context. And then, secondly, we used, using Smartboard MR, participants could annotate the leaflets directly, providing feedback on specific elements of the materials. And this dual approach worked really well. And I have to say that this enabled us to collect both very detailed qualitative responses and visual elements. We used the heat maps produced through Smartboard MR, showing them to stakeholders who could very easily grasp how the participants perceived the materials. And as a result, the insights provided immediately, directly improvements to the leaflets on both content and design. And the leaflets were amended and shared with participants and patients afterwards.
So, Virginia, how would you describe your working relationship with the FlexMR team?
I will describe my working relationship with the FlexMR team as based on collaboration and mutual respect. We created a strong foundation through regular communication, using monthly meetings for discussing upcoming and current projects, but also having some dedicated quarterly sessions for strategic discussions and reviewing how we work together. and we both signed the Working Well Together Charter, which is an ORA initiative to improve well-being in our industry through better ways of working. And I think this reflects our commitment to collaboration and continuous improvement.
Great. So, Virginia, what are the things that you think the market research industry is currently doing really well, and what most annoys you about the industry?
I think the market research industry is doing very well in two key areas right now. Firstly, I think there's a real culture of sharing learning, and that it's whether it's through using case studies or community of practice or even webinars, that is raising the bar for us all and helps us apply insights that are more effective. And secondly, I have to say I'm very encouraged by how the industry is exploring innovation, especially around artificial intelligence. There's a lot of exploration and experimentation around how we can enhance how we understand people's behaviors and drive meaningful change. But that needs careful consideration, obviously, on how this affects participants' experience and also introduction of bias, of course. What I find a little bit frustrating about the industry is that we talk a lot about inclusion, but that not always translates into action. There's a lot of talking about about the importance of inclusive practices, but we're a long way to go from embedding it across the industry consistently. And I think there's a real opportunity for us to shift from intention to implementation and make sure that inclusion is embedded in everything we do, from research design to recruit participants or even communicate findings.
So, Virginia, if you could challenge the market research industry to adopt one new mindset or practice, what would it be and why?
So if I could challenge the market research industry in adopting one new mindset, would be to embed inclusion by design and not just as an afterthought. So that would mean to design research that from the start is taking into account and representing the diverse populations that we serve, not only in who we speak with, but also in how we engage with them, interpret their experiences, and communicate the findings from the research that we run with them. When we use inclusive practices in research from the start, our insights are not only more relevant, but they're also more trusted, and therefore they're also more impactful.
So, Virginia, how do you think new technologies can help the industry move forward?
So I think new technologies that can help the industry move forward are those technologies that make research more agile, inclusive, and impactful. And that means enabling participation from different languages, different literacy levels, but also different digital access points to make sure that all populations are fairly represented, and especially those that are underrepresented are involved in research more consistently. And I think the kind of technologies that we talk about should be supporting mixed methods approaches, and most of all visual storytelling. That is because this would enable us not only to understand complex experiences, but also to communicate findings in an accessible way, which is also more compelling for decision makers and for the public.
That's great. Virginia, thank you very, very much for your time today. It's been most insightful. Thank you.
Thank you. It's been very nice to be here with you. Thanks.